6-year-old girl is being investigated for renal failure. She is found to have congenital abnormality of the insertion of ureters into the urinary bladder. What is the most likely cause for renal failure in this patient? She would have vesico-ureteric reflux, and the renal failure is caused by reflux nephropathy. Acute tubular necrosis happens if a process destroys the tubules in the kidneys. This is a tumor. Polycystic kidney disease would have been picked up after birth, and that's a multisystem condition with SLE. Newborn that is electively intubated at birth and is due for surgery 48 hours after birth. Condition was suspected on antenatal ultrasound and confirmed on chest X-ray after birth. What is the most likely diagnosis? This baby has congenital diaphragmatic hernia. Cystic fibrosis is not diagnosed on ultrasound antenatally. Cystic adenomatoid malformation does not require surgery after birth. RDS is seen in very preterm babies and has no surgical management. And alpha-1 antitrypsin leads to chronic lung disease and chronic respiratory infections. 9-year-old child has cystic fibrosis and develops chronic pneumonia. Which organism is commonly responsible for this? Pseudomonas can colonize patients with cystic fibrosis. They are getting infections with staph, streptococcus and Haemophilus, but chronic colonization is seen with Pseudomonas in most older children with cystic fibrosis. 3-day term breastfed infant is brought by mother who reports that child has not been active and not feeding well. She also notices jaundice, which was not present at birth and is increasing. Temperature is 35.4. Liver is palpable 2 centimeters below the costal margin. What is the most likely diagnosis? So this baby is unwell and you would suspect sepsis, which does not always have any hard signs. Sepsis will make a baby less active and not feeding well and having a low temperature. So you would suspect that. Jaundice is common in many babies, but sepsis can also increase the jaundice. Infant is being examined as part of routine examination. Child can hold his head up, lifts its chest off a table, has got a palmar and rooting reflex as well as social smile, is not afraid of strangers. What is the most likely age of this child? 6 months, as this child, head holding comes at around 2 months age. By 5 months, baby is able to push its chest off a table when lying on the abdomen. The newborn reflexes begins to be lost between 6 months to 9 months. Social smile would have already appeared by 2 months age. Beyond 6 months, children start to be afraid of strangers. 2-month girl has antenatal diagnosis of right hydronephrosis. Postnatal serial ultrasound examination confirmed dilatation of right pelvic ileal system. What is the appropriate management? So this child has antenatal renal tract anomaly and requires prophylactic antibiotics and monitoring. Most infants with such dilatation resolve with just prophylactic antibiotics over time. Drugs are not needed. Intermittent catheterization is required if there is neuropathic bladder. Surgical repair may be indicated for some infants in later stage. Mother brings 1-year-old infant to her pediatrician and describes that after a common cold her child's voice became hoarse and has developed a cough which sounds harsh and brassy and was worse at night. Child was noticed to have stridor. What cause is most likely to be? Croup is commonly caused by para-influenza viruses. Infant has diarrhea for 3 days with weight loss from 10 kilograms to 9 kilograms. On examination, he is having a dry mucous membranes, poor skin turgor, markedly decreased urine output and tachycardia. Blood pressure is normal, but central capillary refill is 3 seconds. Appropriate fluid for resuscitation would be always normal saline for resuscitation as a bolus.